Greetings. Let us talk about and learn about the role of Bravo 96-hour pH study in the evaluation of patients with heartburn. These are my acknowledgements. And when you see a patient with heartburn and you want to assess whether the patient has gastroesophageal reflux with gastroesophageal reflux disease or not, we go ahead and perform an endoscopy. If the endoscopy shows erosions, that is Los Angeles grade B, C, or D erosive or if the patient shows a Barrett's esophagus of at least 3 centimeters or more, or if the patient has peptic esophageal stricture, we know that the patient has gastroesophageal reflux disease. On the other hand, if the esophagus is completely normal with a normal, clean squamocolumnar junction, we need to figure out whether the patient's heartburn is due to gastroesophageal reflux with a normal esophagus or non-erosive reflux disease, otherwise known as NERD, or is it a functional heartburn, or is it a reflux hypersensitivity of the esophagus? How do we differentiate these three conditions? You go and perform pH study to evaluate abnormal esophageal acid exposure. So when you plan to do an endoscopy in a patient with heartburn, it is also a good idea to plan not only endoscopy, but also plan for Bravo pH study at the same setting so that if the endoscopy shows no damage to the esophagus, no erosive esophagitis, no Barrett's esophagus, no peptic stricture of the esophagus, then you can automatically go ahead and perform the Bravo test at the same setting. For this, it's a good idea to plan this. And how do we go about doing the Bravo pH study? We make sure to measure the squamocolumnar junction location. That is very important because you have to position your Bravo capsule 6 centimeters above the squamocolumnar junction. So that's why you should mark the squamocolumnar junction when you plan to do the Bravo test. And Bravo test deployment is relatively simple. Once you measure the distance of the squamocolumnar junction, you decide how far above you should push the catheter, and then by a simple mechanism, you could deploy the Bravo, and then you have to check the correct placement of the Bravo capsule by repeating the endoscopy and documenting successful deployment of the Bravo capsule. Before the patient goes home, the nurses do go through special set of instructions about this 96-hour pH monitoring study. The patient will be given a Bravo reflux recorder that he or she should keep with them all the time for the next 4 days, and they should have it on them or within 3 feet if they need to go and have a shower. The nurse will also educate them about the various buttons that they need to press for on, pressing the meal button, the sleep button, and the symptom buttons on either side of on. Patient is also given a diary to record different events that are happening or that's going to happen for the next 96 hours. After that, the patient returns the Bravo recorder. Patients are instructed to avoid MRI for a few weeks after the procedure. Let us look at how the Bravo esophageal pH study result looks like. So this is going to show the pH tracing, and this is a tracing of 24-hour period, and the nurse records when the patient had breakfast, lunch, dinner, and snack, as well as when the patient went to bed. In addition to this, we also record the amount of acid exposure to the esophagus, acid exposure with a pH of 4 or below. This gives the acid exposure time. In addition to that, we also look at symptom correlation between the pH recording and symptoms. How many times pH dropped to 4 and correlated with a particular symptom. So when you look at this report, you basically ask yourself, is there increased acid exposure time? pH of less than 4. Why pH less than 4? You know that stomach secretes acid, stomach secretes pepsin. Pepsin becomes inactivated at a higher pH. So one is total acid exposure time of the esophagus and symptom correlation to pH episodes below 4. So now that we have some idea about how Bravo pH test is done, let us look at how do you diagnose gastroesophageal reflux disease based on acid exposure time of pH below 4. It's important to do the Bravo test when the patient is off PPI. That is very important when you're thinking about diagnosis. You also do Bravo test to see whether the patient who has a confirmed diagnosis of GERD but continues to have symptoms on PPI, and you want to see whether patient needs to adjust the medication. In that case, you do the study on PPI. For establishing diagnosis, the Bravo test is done off PPI. So now let us look at what are the criteria to diagnose gastroesophageal reflux disease. You know that we did a pH study for 96 hours, 4 days. And we are looking at pH drop below 4, okay? And how much of the time is the pH below 4? What's the percentage of time that the pH in the esophagus was below 4? So that's what we are looking at. If the acid exposure time of pH below 4 is above 6% for 2 or more days, then you know that this is gastroesophageal reflux disease. On the other hand, if it is just for more than 1 day with an acid exposure time of more than 4%, this is borderline GERD. If on all 4 days acid exposure time is less than 4%, then you can say the patient does not have GERD. So in this case, all 4 days acid exposure time is less than 4, but the patient complains of heartburn. You should think about functional heartburn. If that patient has some symptom correlation with pH dropping below 4, then there is a possibility that there could be reflux hypersensitivity, in which case PPI trial might help. I hope this is helpful. Thank you.